WTHR Cares. Focus on the community.
Join 13 WTHR Cares in honoring survivors or loved ones lost to heart disease. In today's focus, the Indianapolis Heart Walk. I'm joined by Pam Hunt, who serves on the board of directors for the American Heart Association, and she's also vice president of patient care services at Community Heart and Vascular. It's good to have you with us today.
Thank you.
We've been proud, Channel 13, to be a partner with the American Heart Association for this Heart Walk year after year. You are a volunteer board member for the Heart Association. Why do you volunteer?
Well, obviously heart disease is part of my profession and has been part of my passion for my whole career in nursing. But also I have family members that have been touched by the disease. And just a little story about that.
Sure.
My father-in-law actually had a myocardial infarction, a heart attack, just about a year ago, and had intervention as part of that, and actually
81 years old?
81 years old. Ended up having surgery, and this summer was diving off the diving board with the grandkids and with the kids in the pool. So, you know, just such a great story of how far the treatment of heart disease has come.
I was going to say that. People don't understand. The American Heart Association has really had a lot of impact over the years through treatment and research, the role that they play.
Absolutely, and you know, that is part of the funds that are raised through the Heart Walk go to research, and that's one of our main objectives at the American Heart Association. We don't appreciate sometimes what pharmaceuticals we have now that control diabetes, that control hypertension, that are risk factors of heart disease.
And that's what you talk about when you go out, some of the risk factors that we need to be aware of, right? Of
Absolutely.
Heart disease.
As I talked about hypertension and uncontrolled diabetes and uncontrolled cholesterol, another main initiative is obesity. And when we talk about obesity, we're really concerned about childhood obesity.
What can we do to be more proactive to help fight heart disease before we talk about this walk?
Sure. Well, we can be more proactive by absolutely understanding the risk factors of heart disease and getting out there and making sure that our families, we're the caregivers for our families, making sure that our families are put in front of those risk factors and really trying to decrease our risk for heart disease.
And exercise. One step to that is taking part in this Heart Walk.
Absolutely.
To get your fitness regimen started. If you haven't started, there's a walk and a new 5K run.
Yes, absolutely. I talk about, you know, oftentimes we have January 1 as the time where we make all these New Year's resolutions. How about making September 17th your New Year's resolution?
That's when the Heart Walk takes place, September 17th. They can register right now. There's no cost to pledges is what you do. You can see the walk is 1 mile and 3 mile, all free. And then the 5K, you do pay a $25 registration fee for the run.
Right.
Go to WTHR.com's community page for more information. And thank you for great information, Pam Hunt.
Thank you.
American Heart Association is doing important work, and thank you for volunteering.
Thank you.
Back to you.